Recording in progress. Excellent. All right. So knee day today. I want you to remember that this is not a diagnostic knee day. Gold standard for knees is always getting personalized exercises. So make sure that if you have something acute, so an immediate knee injury or something that is locking in your knee or something that you need more of a diagnosis, you get it looked at first. When you can get it looked at, obviously. What we know about knees, and my background is mostly in knee osteoarthritis, which is your general wear and tear, inflammation in the knee joint, which most people have. About a third of people above the age of 50, if you look at their knees on a radiograph or an x-ray, have some sort of wear and tear in the knee. That does not mean they necessarily have pain. So what we find on the scans is that how bad people's knees are on the scans doesn't necessarily correlate with how much pain they have. And the only evidence-based way to reduce pain without having a knee replacement surgery is exercise. So general moderate exercise combined with stretching, as long as it's nothing that can cause injury, for example, changing directions in things like squash, is good for you. Basically, they've shown exercise and all sorts of different types of exercise. So whether it's cycling or walking, not generally impact or really fast changes of direction. I'm just going to pin that top. It's good for your knees. But today we're going to focus on strengthening, because when there's knee pain, we get some imbalance around the knees. So hello knees who haven't seen the sun in ages. You're going to have a roller or a cushion or a ball or something that you can pop under your knee for me to start, so we can have a look at these beautiful knees. When there's pain or swelling or inflammation in the knee, what tends to happen is the inside of your quadricep muscle gets a bit weak and the outside of the quadricep muscle gets tight and overactive and overused. All right, again, this is generally speaking, but it happens quite commonly. So what happens, and you can see it if you've got one dodgy knee, as you straighten your leg up, if your hamstrings are tight, you just lean back a little bit here. As you straighten your leg up, you want to get a squeeze on this muscle on the inside of the quadricep, so the inside of your thigh just above the knee. Cool. And you actually want to try to get that squeeze happening before the outside of the knee muscle. All right, so if you have a look, get a really good squeeze. We call this one terminal leg extension, because you want to straighten the leg all the way up. It doesn't matter to me if your foot is point or flexed. It's really about straightening the leg completely to get a squeeze onto the inside of that muscle. Compare that with your other knee. So if you have a dodgy knee, you should see a difference side to side. And anytime there's pain or swelling in the knee, what the research finds is that that internal quadricep muscle gets inhibited with pain and swelling. So anytime there's pain or swelling in the knee, you want to come back and do these boring old exercises where you're just straightening the leg and bending, because what we're trying to do is just tell the brain it's safe to move and that we want that internal quad muscle on. Cool. So if you've got a dodgy knee, go back to dodgy knee and you're practicing straightening it all the way up and releasing, and do it with a bit of a turn out. So externally rotate your leg slightly and you're going to straighten and bend. But if you've got a Baker's cyst or a bit of swelling at the back of the knee, move the roller so it's not resting on that spot. And sometimes that's a little bit more comfortable. If you don't have a roller or a cushion or something, you can actually sit in a chair and just have the chair right to the edge of the knee and you're just straightening and bending. You can also do it lying down. You can do it all the options anywhere. Oops. The guitar falling down. Good. So again, a slight bit of turnout, straighten that leg. And we start with this, even though it's a little bit boring and not very exciting, because we're going to use that muscle, that's your vastus medialis, in the other exercises we're going to do. Okay, so you can either lie down. If you're not lying on the floor, you can do this next one sitting in a chair. What's important here, when I say lock the knee, we don't usually lock our knees when we're standing. When I say lock the knee and lying, what I want you to do is straighten the leg enough that you can find that muscle. So you have one knee bent because that protects your back. You're going to have your core on. You're going to pull up through the quad to lock that muscle on, and then you're going to lift the leg up to the height of the other knee and back down. Now I want a slight bit of turnout through the leg, so we're focusing on that inner quad muscle again. So you're lifting it up to the height of the other knee and lowering it back down. And we'll do a few of these here and just notice. So if you've got a dodgy knee, what you should find is that when you swap sides, the other side just feels heavier, a little bit more tired. Cool, so swapping sides now. One knee bent, other leg straight, tighten up. So find that inside quad, lock on that muscle, and then lift and lower here.
If you've got a dodgy back, to add to the dodgy knees, make sure your core is on and the opposite leg is bent, because that just protects your back. Good. If you've got no dodgy knees and you're just here for Pilates, you can keep head and shoulders lifted up as well. Add to the fun. Very nice. Good. Bend your knee. So if you've got dodgy knees, you'd be doing 2 sets of those on dodgy side. Cool. Relax the head down. Pelvic tilts, because core is important. And if you have, again, enough of a dodgy side that you've been limping, we'll find that core muscles on that side are often weak as well. So you're just doing some pelvic tilts here just to flatten the back into the floor and release the back. Good. So breath out to imprint. Inhale to release. You're just moving and mobilizing through the low back, trying just to activate the core here. All right, to activate the core, hold the core on, float one leg up to tabletop. Now straighten the leg right out until you get that squeeze, pull up through the inner quad. Inhale, bend it in. So exhale, reach, pull up through the inner quad. Inhale, bend. 2 more on this side. So again, we're straightening, we're drawing the kneecap upwards, trying to find that medial quadricep. Last one here. Good, bend it in, lower the foot down, keep the core on, other leg up. Exhale to reach out. Inhale, bend it in. Good, single leg, focusing on core as well as that focus of pulling up through the inside of the quad. Good, last one. Good, keep the leg up in tabletop. Tummy muscles are on, the other leg floats up to join the first leg, and you're gonna toe tap. So if this just goes straight into your back and bothers your back, then come back down and do single leg. Otherwise, you're keeping the same angle of the knee and tapping down towards the floor. So the movement's coming from the hip joint, and we're keeping the core stable. Everything has to start at your core, even if it's a knee injury. Breath pattern needs to be good, and you need to be able to stabilize your pelvis to be able to affect the chain all the way down to the feet. Good, 4 more here. Use your breath out. So exhale for 3. Breathe out 2. Last one. Good, one leg all the way down to the floor, the other leg all the way down to the floor, and just take your knees side to side here. Just mobilizing that back. Excellent. If you've got something to squeeze, this could be a cushion, a bowl, a proper Pilates ball, a child, just checking. You're going to squeeze your knees together and breathe out to connect your inner thigh muscles. Inhale to release. Good, so anything you can pop between your knees here to get a squeeze on, find your inner thighs and release. Now, hands are going to dig right into your hip flexors, which are just the muscles here at the front of the hip joint. I want you to squeeze the inner thighs, but I don't want you to feel a lot of bulging at your hip flexors. So hip flexors are just where your hips crease when you're doing a squat. All right, so your TFL muscle here, if you've got a dodgy knee, the TFL connects into that ITB and runs down the outside of the knee. So often what we find, especially in patella pain, if you've got pain under the kneecap, is that this tightness from the hip flexor down the outside of the leg starts to laterally track the patella. So if the patella is supposed to move up and down in the groove, it starts to actually track outwards if there's too much tension, and often it starts at the hip flexor. So what we're trying to do here is reorganize the brain and get it to contract your inner thighs without over contracting your hip flexors here at the front of the hips. Cool. So can you squeeze and find these without getting any bulging through your hip flexors? Some people find this really easy, and other people it takes them weeks. So patience, see what happens. And see if it's harder on one side, on your dodgy knee side, than it is on the other side. So hold just that little bit of contraction into the ball, and you're going to roll up into your bridge position. So pushing the feet down, we're now activating through the glutes, through the back of the hips, and then rolling down one vertebrae at a time. So inner thighs are connected, roll up. A bridge is normally a nice, safe way to get glutes without having too much knee load. If you've got a really sore knee, sometimes the challenge is having the knees bent enough. So if you're post-op, for example, having the knees bent enough that you can actually bridge here. You can have your feet up on something if you prefer them to be higher, on a coffee table or a small, low stool. If you really can't get them bent up enough to lift, you can have your feet on a football and have the legs straight and do a straight leg bridge. Cool. You just want to make sure that you're not arching the back, so keep the ribs down, hips up. Excellent. So this time you're going to hold it up there. Lower your bum halfway down, and you're going to pulse your bum back up for 4, 3, 2, 1. Hold there and squeeze the ball for 4, 3, 2, 1. Bum pulses up for 4, 3, 2, 1. Squeeze knees for 4, 3, 2, 1. Can you hold it there? Transfer the weight into one leg and straighten the opposite leg. This is a definite no for your knee. Just transfer the weight, but don't change the other leg. Cool. So you're transferring the weight. If it feels good, straighten the opposite leg. Transfer the weight. No change to the pelvis as you straighten the opposite leg. Good. One more each side. Straighten. One more here. Straighten the leg. Pull feet down and pulse the pelvis up. 6, 5, 4, 3, 2, 1, and roll down one vertebrae at a time. Take your time, come all the way to the floor. Wonderful. Hopefully you found some bum and some inner thighs. Stretch out the hamstrings now. Tight hamstrings, especially if you've had a surgery in the past that has used hamstring tendon. Tight hamstrings can really affect the loads going on through the knee joint. So straightening the leg as much as possible, flexing the foot down towards you. And I can't quite see my foot. This way. All right. If you don't have a band, my band's about to rip. If you don't have a band, grab a tie from your robe, a towel, anything you can strap around the foot. But this is a nice, safe way, especially if you have a dodgy back, to add to the picture, to stretch out through the hamstring. And we're going to add calf work here. So I'm going to point my toe up towards the ceiling. Hopefully you can kind of see my foot, and flex the foot down towards you. And what you should find, if your knee's really straight, what you should find is that as you pull the toes down towards you, it tightens that stretch in the back of the leg. So we're actually getting more of that kind of sciatic nerve line, and by moving through the foot, we're gliding that nerve. We're also getting calf work. So if you find that you get swelling that can pool down into your calves and ankles, or if you've had a big day on your feet, this is a lovely one just to move through the ankles, get those calves warmed up, pump out any swelling. Because your foot's high, you're going to get that swelling moving right down to your heart, which is good. So it can pump back up through your body. But yeah, anything with feet elevated is really nice. We're multitasking. Go now, hold that position. See if you can bend your knee slightly, and then straighten the leg all the way up. Connect through that inside quad muscle. So inhale, bend. Exhale, press it out, straighten it up. Now, if you're going, whoa, that's really zingy through the back of the leg, you just reduce your range. You do it here. Bend slightly, press it up. So I would like you to still get a stretch, but obviously not an overstretch. So tighten through the quad, straighten the leg. A couple more here. Good, last one. Press it up, straighten the opposite leg on the floor, and cross the leg over the body now. So you're getting that stretch. Often quite zingy, this one, a bit icky, down the side of the leg. And that's that whole kind of ITB, hip flexor structure, even into glute med, that's going to be stretching there. So come back up, change legs in the band. All right, so start just with your hamstring stretch. Feel the difference side to side. Sometimes your dodgy knee side will be tighter. Sometimes it's the other one that's tighter, the one that's doing all the work to support you. So hold the stretch, point and flex the foot. So both need a good stretch out, really. Excellent. So working through the ankle, pumping out any swelling, getting the calf muscle warm. Good. Hold the toes down towards you, bend the knee slightly, and press it up straight. So pulling up through the inside of the quad. Bend, and then pull up through the inside of the quad. One of the big factors when I send people to have a recheck with the surgeon is if they're ever getting that catching through the range, so they can't straighten all the way. Whoa! So what happens if you leave your bands at home too long? It's not nice. Listen, don't snap yourself in the eye, people. Good, one more there. So yeah, catching or locking in the range where you can't move it. That's often when there's a bit of cartilage in the way. Good, so take it over to the side, so straighten your other leg on the ground, cross it over, and get the stretch through the outside of the leg. Okay, legs back up. You're going to roll over onto your side. The other really important part for the knee is your glute control. So if you have a leg that's rolling
inwards every time you walk or squat, that rolling inwards is actually coming from a lack of glute, especially if your knee's been sore enough that you've been limping. Your glute on that side will be weaker. We're going to try 2 different glute exercises, and for homework, you're going to pick the one that gets into the glute the best. So if you've really had trouble with your knee rolling in, that's where we find an external rotation exercise can be really good here. So you're going to spiral this top knee up as high as it can go, keeping your pelvis stable. So don't let your bum roll backwards. Keep your spine where it is, and you're spiraling that top leg up. Good. If you find it quite easy, you can tie your band around your knee so that you have extra resistance to push up into here. Now, where I want you to be feeling it is into the back of your glutes, your deep external rotators, which are here. I don't want you to be getting a lot into your hip flexors. So sometimes with the band around people's knees, they'll end up getting all hip flexors. So find which variation gives you the most into the glute. Now hold that knee up, and you're going to pulse it up higher for 8, 7, 6, 5, 4 more, 3, 2, 1, and then release it all the way down. Good. So you should have felt something getting warm through there. Maybe, yes. And the second really important one is your straight leg raise. Now, we've got 2 muscles that can do this movement. We've got our glute med, which is the muscle we really want. If you think seam of the pants, just behind the seam of the pants. So it makes a fan shape on the outside of the hip. This muscle supports us every time we stand on one leg. So start lifting and lowering the leg as I talk to you. All right, so if this muscle isn't working, that's when we tend to limp or offload our center of gravity so that we're not having to use the glute med. Now, if your hip flexor wants to work, so remember, hip flexor is what we don't want to overuse because that comes and contributes into that side of the leg tightness and patella maltracking. Your leg will start to come forwards and you'll start to Cindy Lauper, show me your amazing range of motion. But again, that's mostly hip flexor. So roll forwards with your pelvis, take your leg backwards in space, and now lift and lower here. I don't mind if the foot points or flexes, just think of keeping that pinky toe side of the foot up so you're a nice straight line through the leg. And again, you're only lifting the leg as high as you can go without changing your pelvis, so we're not having lots of pelvis movement going on. So core is working to stabilize your spine. Hold it up there. Make sure your pelvis is forwards, your leg is back, and you're going to circle here. So circle the leg for 8. Now, as you circle, your glute med should be getting warm. If you find that it starts to travel down through the quad, come down, reset, pull the leg backwards more and try to get into that glute. And circle the other way for me for 8. Good, should be getting really warm now. Circles become squares, that's okay. Hold it there, little pulses up for 8, 7, 6, 5, 4 more, 2, 1, and release it all the way down. Give it a pat. Good. Everyone found some thumb? Now we get to do all the same on the other side. Really important to notice a difference. If there's a big difference side to side is when you want to be doing 2 sets on the dodgy side. Cool. So toes together, pelvis stable, rotating the knee up. So spiral the knee up, pelvis stays stable, getting that external rotation. So we're kind of working into 2 different sets of glutes. If either one gets a lot of work happening through the hip flexor and down the outside of the leg, then you want to do the other one instead. Cool. You don't have to do both as regular homework. Excellent. So hold it up there, little pulses higher for 8, 7. Remembering you can do this with the band on. For 5, good. For 4, 3, 2, 1, and then straighten that top leg out. Lengthen the leg as you lift it up and back down. Keep the leg coming back behind you. The pelvis forwards, leg back. Look down at your hip. You should be really open through the front of the hip so that leg's not sweeping forwards here. Keep it coming backwards, lengthen and lift it up. Good. How high can you lift it without collapsing? It's almost like you've got space between the bottom side of the waist and the floor. All right, hold it there. Circles for 8. Bum getting warm yet? Still smiling? Good, and circle the other way for 8, 7, 6, 5. Keep lengthening that leg. 3, 2,
1, hold it there, and little pulses up for 8. Good, 4, 3, 2, 1, and relax it all the way down. Give your bum a nice pat. And roll over onto your front, please. Glute max, gluteus maximus, all right? Back of the hip, really important one for strength and power, especially if you are working back towards running. If you're a runner, even a walker, you need glute max for push off. So first thing I want you to do is find your pubic bone on the floor. Hopefully you haven't had as much coffee as I have this morning. Lift your tummy up and lift one leg off the floor. So how high can you lift the leg without changing the low back? So pubic bone down, tummy lifted, alternate legs. So option 1, you alternate legs here. Option 2 is harder. If it goes into your low back, you come back to option 1. So option 2, you hover both legs up and you flutter. Straight legs. Should get glutes nice and warm. Good for 8, 7, 6, 5, 4, 3, 2, 1, and relax the legs down. All right, next one is weird. Single leg kick. So if you want to, easier option, forehead on the hands. Option 2, you're up onto your arms like so, and you're lifted through your tummy. So pubic bone is down, tummy is lifted, shoulders are down. Again, if it gets into your back, then you just go back onto your front. So what we're going to do is 2 kicks with 1 foot. So you're going to kick with the foot flexed, kick with the foot pointed, and then straighten the leg and release it down. I lied. Point, flex, straighten the leg. So what we're doing is getting hamstring. Now I mess myself up. Hamstring, hamstring, quad, other side, hamstring, hamstring, quadricep. So it's a bend, straighten the leg. So as you straighten, you're pulling up through the front of the quad to lift the kneecap. Hamstring, hamstring, quad. Good. Point, flex, reach it long. Other side, point, flex, reach. So this exercise works on the co-activation, how the hamstrings and the quads work together. So really good if you're at a certain point of ACL rehab. Point, flex, reach. A couple more. So hamstring, hamstring, front of leg, back of leg, front of leg, and relax. Good. Strange. All right, coming up to standing. We're going to do some levels of squats. Option 1, if you are still sitting in your chair going, I can't do any of these, your sit to stands. So from a chair, you're standing up and you're slowly coming down. Cool. What you want to watch, as in any squat, that your knees are not rolling in together. So if glutes are really weak, I'll see this. All right, doesn't have to be on a chair. You can just start standing for me. Now, the best way to squat with knees, or if you can hold on to something and really back your bum up. So see how here I'm almost vertical with my shins? So often people will come really far forwards with their knees. The more you can come backwards with your bum and keep your knees above your heels, the happier your knee joint is. So squats are really good, really important because they're functional. You're always going to go to somebody's house that has a really low couch or toilet and you have to get off it. No matter how sore your knee is, you need the strength to be able to get up. So I always challenge people to find squats that feel good. Now, if that's still not feeling good, you pop your cushion or your ball. You want it something that's probably a little bit big even. A yoga block works quite well, something that maintains that distance between hips, knees, and foot. If you're doing fine squatting, just keep on squatting for me. So the other option is you get a band, you tie it around the knees. If you find your knees are always rolling in, you can have a band there and you keep the pressure. Ooh, doing really well with my bands today, aren't I? You keep the pressure outwards in the band, if that makes any sense. Good, so your knees, you have that connection to remind your knees to keep straight or keep turned out so they're not rolling in on you. Good. Now, if squats are getting easier, what you do next is you squat down and then you transfer the weight onto one foot and then you push up using one leg. So squat down in the center, transfer weight onto one foot, push it up.
So this is bridging you into more single leg squats and step ups where we're still not lifting the other leg off the ground, but you're coming down, both legs, transfer into one leg, press it up. So down both legs, transfer to one, push it up. Down through both, transfer to the other one, push it up. Good, so down through both. Options, you can do pulses here. You can do pulses transferred into one leg. So my weight's now 80% of my weight's through this leg, and I'm going to pulse for 8, for 7. So keeping the other foot on the ground really allows me to make sure my alignment is good. Don't lift the other leg too soon. Come back through center, transfer over to the other leg, and pulses. Good. So if you're still on both legs, that's fine. You can pulse through both. Great, come back to center, press it up. Heel raises. Calf muscles are super important for your knees. So lifting up onto toes, sorry. Lifting the heels up and coming back in. Have a look down at your toes. Through the balls of the feet, you should be putting equal pressure through the whole front side of the foot. You want to watch you're not rolling in or out with the foot. So from the big toe right to the little toe, even pressure through the ball of the foot. If you are a runner, running course I went to said you need to be able to do 25 single leg calf raises before this lady allows her runners to start running post injury, which is actually really hard. If you find calf raises really easy, you're single leg. Cool. All right, now a fun one. For some of you, this might be too much for your knees, but if you're trying to make it into a bit more of a dynamic rehab where we're starting to explore different ground textures and changes of direction, we're going to do a lunge set. Lunge set isn't working for you, you're going to keep squatting forever. All right, so you're going to take one leg back into a lunge, then power up onto that front toe. I'm going to change this back down so you can see. So down into a lunge, power it up. Down into a lunge, lift that heel. Cool, so down to lunge, lift the heel. 3 more this side. For 2. Last one. Good. Now same thing, but down into a big squat. To the side, power it up. So squat, power up onto the toe. Good. For 3 more here. Power it up. For 2. Last one. Power it up. Change legs. So down into that lunge and then up onto the toe. Power it up. Good. For 3 more. Coming to the back. Watch that alignment of your knee. Quite interesting with the camera. You can find my dodgy knee that doesn't want to stabilize. Last one. Good. Out to the side. Power it up. So we're just starting to play with different directions. In this set, you can actually lunge out at all different directions. Adding that calf work in. Good. And then we're going to quad stretch. Too much tension in the quads can also lead to just an impacting kneecap that's almost stuck in the groove. So a quad stretch can be really good. An easier level quad stretch is find something to put your foot up on and squeeze your bum forwards. And that should get you a nice stretch in the front of the leg, and you just hold. If you prefer to grab a foot, you can grab a foot. You just want to think pubic bone forwards. Or, as you know from those of you who come to class, my favorite one, because it takes away any cheats, is lying on your tummy. Lie on your tummy, you grab a foot. If you can't grab a foot, you lasso a foot with band, and you press your pubic bone into the floor. My favorite one, unless you've had too much coffee. Pubic bone into the floor, tummy up, and you're pulling the foot in towards bum. So you're going to hold this on each side for at least 30 seconds and really let that quad relax. So remember, we're looking at inside quadricep. You can do rolling on the outside of the leg if you find that you do have a lot of tension coming down through the iliotibial band. It just hydrates the tissue and almost reminds the brain not to be locking on to the outside of the leg. So anywhere between the kneecap, right up the outside of the thigh and in towards the hip. And you can do this at all sorts of different angles. It is quite sore, but if you have patellofemoral pains or pain under your kneecap, it can be quite instant relief if that's what's causing your issues, or if you have issues down the outside of the thigh at all. Cool. So build up that inner quad, start to release the outer quad. Find that balance between calves, hamstrings, glutes to control the position of the knee, and of course work on your core. So you can practice this over and over and over again. I'll add it to YouTube so you can keep very busy during hopefully not much longer of lockdown. Hope you're all doing well, and we're going to have a stretch, roll and release on Friday. So if you've got any size of roller, rolling pin, quite mean, wouldn't it? Little trigger ball, spiky ball if you've got it, stretch band if you've got it, just whatever you can find that you think you can stretch, roll and release on, and we'll have a good stretch out, a full body massage. All right, thanks everyone. Thanks for coming along. See you soon. Bye.